Hello, I'm Homer Quintana, the Program Manager for the Houston Methodist Center for Rapid Device Translation, which is dedicated to connecting clients to services that move innovative medical devices from bench to bedside with safety, accuracy, and efficiency. Today I'm joined by Robert Quinn, CEO of Patch Medical, a medical device company out of Australia. Robert, it's a great pleasure to have you here.
Thanks.
So tell me about your technology and the type of patients that it is intended to treat.
Yeah, so we're, like I said, a medical device company that's designed to treat the onset of a condition called sepsis. I think I may have mentioned to you before, sepsis kills more people than breast cancer, lung cancer, and prostate cancer combined. And it's a really big deal, right? And so the biggest challenge with sepsis is actually predicting it early. I think the biggest predictor of outcomes in sepsis patients is how early you can predict the onset of sepsis. So we use a technology called artificial intelligence. I'm sure many of the viewers have heard of it, and we use a special kind of artificial intelligence called a deep recurrent neural network in order to predict sepsis. And the way this works for a patient, a high-risk patient, say a chemotherapy patient leaving hospital, we provide them a device to wear during their period of highest risk. At the moment, it's this watch, and it measures heart rate, respiration rate, blood pressure, temperature, and SpO2. Now, this watch, it transmits that patient's vital signs via their smartphone to our deep learning algorithm in the cloud. And we're continuously watching. When I say we are continuously watching, our AI is continuously watching this data. And really what it's looking for is subtle changes in patterns in vital signs that are invisible to the naked eye. Things like, is your blood pressure decreasing at the same time your temperature is increasing? And these really subtle changes and variations in vital signs. And what's really cool is what we've shown in retrospective studies is that just by looking at how these things subtly change and interact over time in ways that are completely invisible to the naked eye, we can predict the onset of sepsis more than 8 hours earlier and substantially more accurately than SOFA, QSOFA, MUSE, and SIRS, which are the in-hospital standards of care. And that's just phenomenally exciting. And that's obviously on a retrospective basis. And that's part of the reason we're here at Houston Methodist right now, is to demonstrate this prospectively. So we'll be providing this device to patients, to chemotherapy patients being discharged, and we'll be monitoring them for 90 days to see if they develop sepsis. And like I said, this will be transmitting all their vital signs to our deep learning algorithm. And at the end, we're going to see how well our deep learning algorithm compared to how, when the patient officially was diagnosed with sepsis in a prospective setting.
Phenomenal. Well, yeah. Congratulations on that. What made you pursue the technology?
Yeah, so I actually started this company to save my own life. That's not a story I think many people get to tell. I had more than 18 episodes of sepsis following a liver transplant. That's a very, very high number, especially when you consider that sepsis kills, 1 in 6 times. So statistically, I'm an anomaly. I mean, realistically, I should be dead, and I'm not. And the only reason that I'm alive is that I can tell I'm getting sick. I get sore legs and a warm face. I get like this burning quads and this warm face. And I show up to the hospital early to be treated. So what we realized was that, hey, if I can tell I'm getting sick and then save my own life, we can probably use some sort of deep learning and wearables to do the same thing for others. And that's sort of how the company started.
Phenomenal. Now, I mentioned in the introduction that you're a company out of Australia. What brought you to the Texas Medical Center?
Yeah, so we're a company based. We were a company originally out of Australia. We ended up moving to Silicon Valley after that, and we were really drawn to Texas, to Houston specifically, because of the Texas Medical Center, and partly because of Methodist and the research that's going on here. It's really a hub, I think. TMCX was a big part of that. So TMCX, we went through their accelerator, and they really just helped us connect us to a lot of the Texas Medical Center hospitals, and obviously Methodist, which is where we decided to do our study. So that's why Texas. It's why Houston. I think you have a huge concentration of cancer hospitals and a lot of really top-notch research coming out of here. In fact, at Methodist, the person we're working with developed a sepsis prediction style algorithm for Methodist patients on the inpatient side, and saved a lot of lives. And so he's sort of been mentoring us and helping us with this product as we go.
Well, it's phenomenal that you've been able to gain such traction within the Texas Medical Center. This is the largest medical complex in the world, and as an innovative hub, it's great to see companies like yours coming in our direction. Yeah. So tell me about your experience with Houston Methodist.
It's been fantastic, honestly. I think for us, it's been the people that we're working with. I mean, so we're working with 4 clinicians here, like particularly in the critical care space and in the oncology space. And as I said, one of the people, one of the clinicians we're working with, developed a system very similar to this, right? Mm-hmm. And so it's been really cool to work alongside him and really get that that knowledge of what his real world experiences with the condition are, because it's all great to build a medical device company and have this this watch that transmits data and it's beautiful, and but it's a completely different story when you start looking at real world. What happens when a patient hits the emergency department? Like when the emergency department clinician who's worried about a patient in bed 6, like how are they thinking about that sepsis patient when we're sending them in before they even look unwell? Right. And so he's been really good to help us think through a lot of those logistics.
Well, fantastic. It seems like it's been a very valuable collaboration between the two of you. If there were a few highlights of that collaboration that you could share between Houston Methodist and Patch Medical, what would those be?
Highlights between Houston Methodist and Patch Medical. Honestly, I think access to the patient population that you guys have here. Obviously, you're a top 20 cancer hospital in the United States, one of the best. And I think that the team here moves really quickly. Like when we needed to get things done, you guys moved, and it was fantastic. So I think that's been a real highlight. Getting access to these patients. I mean, just talking to the clinicians we're working with, they knew immediately which patients this would be most applicable for, and they were already thinking about and directing us to those patients. So yeah, I think that's probably been one of the major highlights of working with Methodist.
Fantastic. So you would say Houston Methodist has taken a very proactive approach in treating a very specific patient population and engaging with you, an industry partner that's developed a technology that's going to benefit that patient population.
100%. And I think just the thinking around, like, so a lot of times when you say to someone, hey, this is what we're trying to do, they're like, oh, great, like, what patients would you like to put this on? Like, the questions are always like, what would you like to do? And that is still the case here. It's like, what would you as the sponsor like to do? But what I think is really cool is that at Methodist, a lot of the clinicians will be like, okay, fantastic. We think that this population might be something really good to look at. Have you considered looking at this population? Have you considered, in terms of inclusion and exclusion criteria, you might want to consider taking out patients with an LVAD, because that might reduce the accuracy of the device, things like that. Yeah.
Phenomenal. Now, in terms of the Houston innovation ecosystem, what's your perspective in comparison to other places that have similar ecosystems in place?
So I will say we are a fairly young company, so we are fairly naive. We don't have a whole lot of experience. Most of our stuff was done in Australia. Mm-hmm. I would say you have, you yourself are very instrumental in this, right? Because you're head of the innovation arm. And so for those of you who don't know, Homer obviously leads, is one of the major leaders in innovation at Houston Methodist, and he really pushes stuff forward. So Homer really got us in front of the people that we needed to get to. So I think that's the major part about Houston innovation that I think's different to a lot of other places we've talked to, is having a department that's really championing that innovation forward. And there are other hospitals that do this as well, but our experience with Methodist has been really positive, especially with yourself leading the program, and sort of you just got us to who we needed to talk to within one step. There wasn't 4 or 5 steps to get there.
Right, and that's part of just building ecosystems and being involved with TMC Innovation, for instance. You were part of the TMCX 09 Accelerator in 2019, and really opening those doors for startups, industry partners to collaborate with clinicians in longitudinal projects that are going to really bring significant change to the clinic. Yeah. Now, for those in our audience that are watching and are companies themselves and are thinking, Houston seems like a really great place, perhaps for my company. Yeah. What would be your first piece of advice to them, or some words of advice?
Talk to Homer. Reach out to this guy. I think that'd be my first piece of advice. He'll tell you who the right people to talk to are. In terms of collaborating with Methodist, TMCX is a fantastic resource, particularly if you're a younger company. Obviously, if you're a Series A, Series B, I think that actually TMCX is probably pretty good for Series A, Series B. But when you're starting to look beyond that, this is your 7th clinical trial. Then getting directly in contact with the research institute is fantastic. But yeah, I would say TMCX and Houston Methodist head of research Homer is the right place to start. That's sort of how we started, and that's where we ended up where we are right now, running a study with you guys.
Well, you're not the first company that's come to the Center for Rapid Device Translation, and you won't be the last. Part of what we do is really to facilitate these projects and the workflow that's involved and make sure that we move quickly and efficiently. We understand runways, and we understand the desire to make a benefit at the patient and healthcare provider continuum. Yeah. And so part of that is just moving very quickly and with a focus in collaboration with our partners. Yeah. Last question for you. Tell me your favorite thing about Houston. You've been here, since 2019. I'm sure you've got a couple of fond memories or great things that you enjoy about this city. Please tell me.
We've bounced backwards and forwards to Houston a fair bit. What is my favorite thing about Houston? Honestly, Montrose, and that sounds really strange, but it just has like everything, like it's just beautiful. I mean, like it sounds so strange just to like list a suburb, but we're currently staying there in a VRBO, and honestly, everything's within walking distance. Like, I can have barbecue at the pit room. I can go up and walk along the bayou. I can do yoga in the morning. I mean, like it's fantastic, and it's a very active city, which I wasn't sure what to expect coming to Texas, but Houston itself, like you see people running all the time, like bike riding, soccer, you name it, sports, everyone's out there. So I think that's probably my favorite part about Houston is it's just a very like active city and it feels very alive.
Well, it definitely is an active city, no matter if it's 100 degrees outside or 30 degrees in the winter and potentially freezing. We like to stay engaged and we love to use our natural resources here. Robert, I want to thank you for your time with me today in discussing your technology and company.
No worries.
I look forward to hearing amazing news concerning Patch Medical in the future. This interview was conducted by the Houston Methodist Center for Rapid Device Translation. For more information, please visit www.rapiddevice.translation.org.